Always speak to your doctor before starting an exercise program. If you feel any pain, pins and needles, dizziness or discomfort during or after these exercises, seek medical advice from a health professional immediately. This program is for educational purposes only, and reliance on any information in this video is solely at your own risk.
Hi there, I'm Fleur, and today I'm going to show you a really basic Pilates standing exercise routine, which is good for pregnant ladies because it's standing, and also people that have trouble getting on and off the floor, maybe due to back pain or discomfort. So it's really basic and simple. It works your core muscles, so it's all about technique rather than straining anything. So it's very basic and easy to follow. So the first thing we want to talk about is our T-zone, which again is a Pilates term, and the horizontal line of the T goes from here to here, and the vertical line goes from your pubic bone up. So when we're doing all these exercises, I want you to think about the horizontal line scooping in, and you're trying to imagine that you're pulling both of your hip bones together. Now the pubic area, we want to pull that up, and we imagine that we're trying to stop ourselves from going to the toilet. So that's going to activate our pelvic floor muscles. So through those exercises, try and work on the T-zone and activating that. So the first exercise is just a gentle shoulder roll, and we want to make sure our feet are hip width apart, our arches are slightly lifted, and we've got even weight on the toes and also the heel of the foot. So I just want you to go up and down slowly. Good. And keeping that T-zone on as well, so we're working on our core at the same time as doing this relaxing shoulder roll stretch. Good. Now I want to do a side stretch. So one hand down by the side, the other one is lifted up. As we breathe in, we're going to stretch up, activate our T-zone, and we're going to breathe out as we gently lean to the side. Breathe in, breathe out, stretch a little bit further. Breathe in, breathe out, stretch a little bit further. Now, if you feel any pain or discomfort, obviously stop straight away, but this one's usually pretty comfortable, and just stretch as far as you can, just to feel a light stretch of the muscle and nothing too strenuous. Good, and now we're going to bring the other arm up, breathing in, stretch up, breathe out, bend to the side. Breathe in, stretch up a little bit, breathe out, go to the side. Keeping our T-zone on, so this is tight. Breathe in again, breathe out, stretch to the side. So our next exercise is called bent knee fallout, which is going to work our T-zone and make sure that our pelvic stability is right. So it's really important to keeping the pelvis stable. So I want you to tense the left glute muscle, so try and tense that buttock. Now bring this other heel into the side like this. We want to take a deep breath in. As we breathe in, we can gently lift the knee to the side, and then as we breathe out, you're bringing it back to the center. Good. Breathing in, bring it out to the side. Breathe out, bring it back to the center. Now really make sure our T-zone is working, and we're not actually rotating our pelvis at all. So our pelvis should stay in a line. We shouldn't be twisting like that. It's basically just a small movement of the knee without anything else moving. So that's why it's very specific to pelvic stability and keeping our core working nicely. Keeping our shoulder blades back and down as well, and our head up. Good. Now just relax that leg. Now we want to tense the right buttock. Bring the heel into the side. Good. T-zone on, shoulders back and down. Breathing in as we come to the side. Breathing out as we come in. Breathing in as we go to the side. Breathing out as we come in. Making sure again that our pelvis is stable and our T-zone is switching on. So it's a very subtle movement, but it's very important to be working these specific muscles. And we're just going to do one more after this one. Good. Now the next exercise is called lift foot, which is working our abdominals and our hip flexors. So I'm going to turn onto the side so you can see what I'm doing. So on your, basically what I want you to do is keep your core, your T-zone switched on. We're going to tense the right buttock. We're going to take a deep breath in to prepare, and then we're going to breathe out as we lift the left leg up. Now we can keep our hands on our hips to make sure this is working. Breathing in as we lower down. Breathing out as we lift the other leg. Breathe in, lower down. Tense the buttocks. Breathe out as we lift the other leg. Breathe in, lower down. Breathing out, lift. Now, again, we're making sure that we're always keeping our pelvis very stable. We're not rocking. And again, you can have your hips down, your hands down, but having the hips to touch through here is probably important because we can make sure that our T-zone and the muscles here are actually working. And that's why it's important to often have a short top or a tight top so that you can see what your muscles are doing through here and make sure they're working properly. Great. Now the next exercise is called lift and extend. So let's get the position right. So bring your shoulder blades back and down. Tense the buttocks. Take a deep breath in. As you breathe in, we want to tense that right buttock. We're going to lift the left leg up. Then we're going to breathe out and we're going to extend the leg. Breathe in as we bring it back. Breathe out as you lower it down. Now pop your hands on your hips if you want more stability. Breathing in as we lift the right leg. Breathe out as you extend. Breathe in, bring it back. Breathing out, lower down. Breathe in, lift up. Breathe out, extend. Breathe in, come back. Breathe out, lower down. And we're just going to do one more where I'm going to explain to you the breathing. Breathe out as you come out. Breathe in, come up. Breathe out, come down. Now keep going. What I want you to make sure that you're doing is keeping your pelvis really stable, your T-zone switched on, your shoulder blades back and down, and everything is really stable. Oh, don't forget your buttocks. They should be switched on as well and tight. It's going to give you really supported lower back, and very important, especially if you're pregnant, because you want to make sure that everything's really strong and stable as you get slightly larger and the ligaments are starting to loosen a little bit. It's really important that everything maintains good strength. Good, and we'll just do one more on the right side. Good. Okay. So the next exercise is for our lower trapezius, which is good for our posture and keeping our shoulder blades back and down. So what I'd like you to do is basically stand like I'm standing. I'm going to show you, probably from the side might be easier. We want to take a deep breath in. As we breathe in, keep our T-zone on, and then breathe out as we bring our shoulder blades back and down. Breathe in, relax. Breathe out, bring our shoulder blades back and down. Breathe in, relax. Keeping the T-zone on, breathe out, shoulder blades back and down. Making sure that we're keeping our T-zone on so that we're not flaring the ribs, but we're keeping this really supported. Just do 3 more. Okay, so the next exercise is glute squeezes. Now the glute muscles are here and they're very, very important to keep strong, and we've been working on them a little bit anyway, but what I want you to do, standing there, pop your hand on the top of your buttocks and I want you to squeeze your glute muscles, so you should feel that muscle tensing up. Keep your T-zone on, make sure your feet aren't collapsing in, and we want to relax them. Good. Breathe in to activate the T-zone, breathe out and tense those muscles in the buttocks. Breathe in, relax. Breathe out, tense them again. Breathe in, relax. Breathe out, tense the buttocks. Now keep going. You might find that one buttock is a lot easier to tense than the other one. So really focus on that one that's not firing properly. Make sure those muscles are working. And again, keep this T-zone on. These muscles always need to be activated to support the lower back. Good, and just 3 more. So our next exercise is hip abductions. So I want you to keep your T-zone on, make sure that your feet are hip width apart, you've got a slight arch in your foot, you have even weight throughout the foot, and we have our shoulder blades back and down. So keeping our buttocks tense, take a deep breath in, breathing out and lifting the right leg up, really squeezing the left buttock and the right buttock as well. Breathing in, come down, breathing out, coming up. Breathing in, come down, breathing out, lifting up. Now, if you're finding it really hard to balance, I just want you to take it really slowly and don't lift your leg quite as high. Really keep your core on, and basically you just want to do a very small movement so that you're working the buttock on the stabilizing leg as well as this leg to lift the leg up. Good, and we're just going to do 4 more. And you can keep your hands on your hips if that's easier for you. Good. Now really tense that right buttock. Take a deep breath in to prepare. Breathing out and lift that left leg. Breathing in, lower down. Breathing out and lift. Keeping the T-zone on. So as I said before, a lot of these exercises are just about quality rather than quantity. So even if you're going to do 5 and you do them well, it's better than doing 10 with poor technique. So 1 more, good, and relaxing. Now the next exercise is for hip extension and buttock muscles. So I'm going to go to the side so that you can see what I'm doing. And again, we are tensing both of our buttocks, keeping our T-zone on, shoulder blades back and down, and we're going to raise the left leg and extend it back. And bring it back in, and extend, keeping everything really tight. And we're breathing out as we come out, breathing in as we bring in. And just 3 more. Good, and now the other leg, buttocks tense, T-zone on, shoulder blades back and down, and we're squeezing the right buttock as we extend and keeping the left one squeezed as well. Make sure you're breathing out as you extend. Good, and just 2 more. Okay, so the next exercise is calf raises. So we've almost worked our entire body. So feet hip width apart, and what I want you to do is come up onto your toes as you breathe out. Keeping your T-zone on and making sure our shoulder blades are back and down. And we're keeping our foot straight as we come up. And if you really struggle with the balance initially, you can lean on a wall or something so that you're not going all over the place and straining something. Even, you know, a bar stool or something like that, a kitchen bench, something that's going to keep you stable initially until you really start to feel that you can do the exercises without falling over or hurting yourself. We don't want that. Good, and just 1 more. Ooh, nearly lost my balance. Okay, now the last exercise is some squats, and they're really important, especially if you have had a lot of back pain and you do a lot of housework, which most of us have to do some. It's really important to be able to bend and lift correctly. So bending is a squat action. So really, when you're squatting, what I want you to think about, and if you find it hard, you can actually just use your hands to balance on your thighs. I want you to come down and imagine that you're sitting on a chair, and as you come down, keep the T-zone on, shoulder blades back and down, and you want to keep a neutral spine position. So you're really sticking your buttock out, and as you come up, you're squeezing your butt muscles and pushing your hips forward. So coming down, good. Now make sure that your knees are pointing over your toes so that you're not going in or out, and we really want to make sure that you're only coming down to where you feel comfortable. If you go too far, you're going to lose your balance. So just want you to do a few of them nice and gently. Really extending your hips as you come up, keeping your T-zone on, and you can bring your arms out like that to balance if that's more comfortable. So just want to do 4 more. Imagine that you're sitting on a chair, so there's a chair behind you, so you're really extending your buttock down. I'm going to do a few more. Good. So if you get any knee pain or issues, make sure you get someone to check your position and make sure that you're not hurting yourself. It's going to finish off with some roll down. So keep your knees slightly bent. And we're just going to roll our neck down and slowly come down. Now, if you have a lower back problem, a disc issue, this mightn't be very comfortable. So really don't go very far at all. But if your lower back's okay, you can go a little bit further. And you can feel a nice hamstring stretch and go quite far, but as I said, be really careful with it. Good, and we're just going to do 3 more. Really rolling one vertebra down at a time. Good, and 2 more. Good, and 1 more. Excellent. All right, so that's 1 set. If you found it really easy, you can do another one. If you found it too hard, I want you to just back right off. And each time you can build it up a little bit. As I said, doing 2 or 3 sets wouldn't hurt, but you have to build up to that really slowly. So if you have any questions, leave them below the video, and I hope you enjoyed it and look forward to seeing you next time.